pathology. So, precision and reproducibility are much more important in clinical pathology. You don't necessarily want to trust your testing device or your machine sometimes because, you know, it can fail you sometimes. It can be wrong. For example, if an animal's not displaying symptoms of a disease and yet the machine says it has the disease, are you going to believe it? I wouldn't. You know what I mean? And so just be smart. Precision is the ability of a test to give similar results on repeated testing. Like if you test 10 times, hopefully it's the same result every time. If not, then that's not a very good test. It's because it's not very precise, it's not very reproducible. And you can't really trust the interpretation of that test. So, like if you put blood through a CBC machine 5 times in a row, it's impossible that you're going to get the same number every time. Like you wouldn't even want to expect that because that's unrealistic. But it can be very close numbers. There's a coefficient of variation there. It's generally the same, not significantly different. So, take-home message here is that every test is going to be imprecise to some degree. There's going to be some variation when you do repeated measurements. But that's called the coefficient of variation. And it helps you, whenever you know the coefficient of variation, it helps you to know if there's actually a true change or if the changes are just due to random fluctuation. Next is accuracy. Is the result correct? That's probably the most important question sometimes, right? So if you were to run a heartworm test on 100 dogs, some of those dogs really do have heartworm and some do not, and you know it. You can compare the test results to the true status of those dogs. And you can do that to calculate what percentage of the test results are correct, and that helps you know the accuracy of the test. For example, if you've got 2 glucometers, you do a read on the same patient, test the blood sugar level, right? One glucometer says 120 milligrams per deciliter, and the other one says 200 milligrams per deciliter. Well, either one of them's accurate. Hey, Dre Will, and hey, Cranky Cash. Either one of those is accurate, or both are wrong, right? And you want to compare it to an outside source. Hey, Gavin, how are you doing? So the important thing to understand with accuracy is that accuracy is checked by running control samples prior to running a patient sample. If the control sample reads as it should, then we run the patient. Hey, Robert, how are you doing? How are you all doing today? It's good to see y'all, good to talk to y'all. But usually the control samples are the job of the lab to do. They make sure the sample results are reported accurately. You doing good, Robert? That's good. I'm doing good myself, I guess. Just streaming and studying for vet school. I got a couple, or just got done with the first week of vet school, got a couple more weeks ahead of me. What, 17, 16? I don't know. More than a couple, I guess, but anyway. No exams yet, thankfully. I'm grateful for that. Hey, Mag Cave 9, how are you? So whenever you're doing control samples, shout out. Yep, shout out to Mag Cave 9. Oh, Bill? Shout out to Bill. Okay. You're going to do a high, a normal, and a low control sample, right? If the controls are correct, then the test is thought to be more accurate. But if the controls are bad, then you need to redo them, right? Maybe even redo the test. Messi or Ronaldo? Man, a lot of people have been asking that recently. I don't know. I don't really watch soccer. I guess, I don't know. I heard that Messi's been around for longer, so I guess Messi? I don't know. Ronaldo's pretty famous now. I think he boxes now, doesn't he? He does boxing and soccer. But quality control is built into modern heartworm tests nowadays. Most in-clinic tests have control samples built into them. So you don't even have to worry about it most of the time. Hey, Swaroop. Chrissy, how are you doing? Ronaldo? Messi or Ronaldo? Yeah, I don't know. I don't really watch soccer. Okay. So interpreting tests. Obviously, it's important to make a problem list as a veterinarian and a differential list for each problem. Like, what problems is the animal experiencing? And then, what could cause those problems? That's how you treat issues. But you do the same thing in lab work. You see a high albumin or a high total bilirubin. Am I rich? No. No, I am not. Not at all. Well, not in material wealth. But I've got all I need. As long as I've got Jesus, I'm fine. But anyway, moving on. Each abnormal result is a problem. Why don't you make shorts of vet tips, like for people that work at a farm or just have a pet? Well, that's a good idea. Probably, well, before I do that, I probably need to become a veterinarian first, which I'm not yet. I am in vet school. I've got about 3.5 more years until I'm a veterinarian. But, amen. But yeah, I mean, that's a good idea. I probably should do that. But I don't think I mean, I know a little bit, but I feel like I don't know enough yet. But I'm trying to learn. Anyway, abnormal results on the lab work, it'll say high, low, whatever the value is. If it's high or if it's low, then you're like, okay, that's abnormal. How abnormal depends on, what it is and how much it varies off of the range. And things can also be wrong with your test. What if your blood sample's hemolyzed? Not good, right? Yeah, I guess I do know a little bit more than most people, but yeah, I mean, I'll try doing that. I'm doing that a little bit. I've been posting a few shorts. But these are called reference intervals, those ranges. You might have had a blood test before, and you see all the numbers, and then there's like these range thingies, and in the middle is normal, this way is low, this way is high, right? So obviously normal might not necessarily mean normal for you or for your pet, because normal is just 95% of clinically healthy individuals tested. 5%, by definition, are going to be outside of that reference range. Because you can also have problems inside the reference range as well. So you can't really, again, these tests you can't put 100% of your trust into. All right. It's important to know the physiology and to know the pathology, which means it's important to know what's normal and what's abnormal. Talking about serum and plasma concentration, if the serum concentration increases, then there's an increased production. There's either an increased production or a decreased loss or clearance of that serum or plasma. So, well, in the blood, it's going to be plasma. But here's an example: serum bilirubin. Where does it come from? And then how is it cleared from circulation? Well, bilirubin is a breakdown component of red blood cell hemoglobin. And so an increased production of bilirubin can be due to hemolysis. Your blood cells are just lysing, which means breaking, bursting. Not necessarily good. Or if it's in a test tube, then you just did it wrong. And that's why your bilirubin can be elevated, because you hemolyzed the blood when you put it in. Or an increased bilirubin can be due to a loss in serum bilirubin, which can be due to liver dysfunction or obstruction of bile. So what else do I do other than vet school? I drum. I've got some drumming skills, percussion skills. What else? Oh, I'm deeply devout Christian. I could talk about the Bible all day. I like swimming. I don't know. I mean, I honestly, I've got less and less time for hobbies in vet school. Very, very busy. So this is pretty much all I can do right now, but I don't know. I'll figure things out. I'll do more eventually. But anyway. Again, the magnitude of a change on a reference is important. There can be a mild change, a moderate change, or a marked change, which means severe, basically. Mild might not be as important. Severe, obviously, is. There's numbers and stuff like that you can measure. The bigger the change in a marker, the fewer the possible causes than a mild change. This, again, goes in with the test specificity we were talking about earlier. So, yeah, being a veterinarian kind of is my hobby. That's true. That's so true. I have to right now, you know? It has to be my hobby. It has to be like everything I do, pretty much. Lots of tests are related. For example, the liver. There's many liver enzymes. There's ALT, AST, ALP, GGT. I do read books. Like, here's a pretty good book that I'm going to start reading. I don't know. I think it's backwards. It might be backwards on y'all's screen. It's backwards on mine. But it says, "Before you say I do, 25 tough questions and answers for those who are dating or engaged." So, like, if I want to get married soon, I'd read a book like that, you know? I mean, my girlfriend and I, we're pretty close. I'd like to marry her someday. But it's important to make sure that you are compatible with your partner. And those are just some guidelines in that book. Books like that, self-help books, nonfiction. I used to read a lot of fiction books when I was in elementary school and stuff like that. I mean, I probably still might if I had nothing else to do, but I don't know. The only fictional things I do really are play video games. So I could record myself playing video games, and I do, but it's on a different channel. So liver function test. Right now I've been playing Dark Souls games, so mostly, well, I got all the achievements on Dark Souls 1 just a couple weeks ago. Played a little bit of Dark Souls 2 for a bit, and Dark Souls 3 is what I've been playing a lot of recently. I did play Elden Ring before getting back into Dark Souls, but Dark Souls 2 and Elden Ring are, to me, they're really confusing. I'm just trying to get through them, you know? And I don't know where to go. I don't know what to do. The gaming channel is called, it was the name of my old Roblox username, Armed Warman. Armed, ARMED _ Warman, WARMAN. What do I play on? I play on my computer. This thing right here. Used to play Dark Souls on the console, but my consoles just keep getting outdated. However, my computers, they don't get outdated as quick, I see. They just seem to last longer. Grouping tests. So when you get a piece of paper that's got all these ranges wrong, try grouping the things that are related together and say, like, oh, if your ALP, GGT, and bilirubin are high or low, then we got liver problems, right? The channel name was Armed Warman. Maybe I can type it in the chat. I don't know. No, I don't think I can. I'll make you a moderator too, Swaroop. I hope I'm saying your name right, by the way. Oh. Yeah, there we go. So there's my channel name. It's probably backwards, but anyway. Here's the PC. It's ROG Zephyrus G14, I think. Okay. Back to it. So yeah, after I'm done with studying today, I'm probably going to be streaming some Dark Souls. Um, yeah. Okay. Sometimes one test will help you with another test. For example, AST is not specific, but CK is specific. Hey, Vikrant. I don't know if I said your name right just there, but Singh, Vikrant Singh. Bro, I am from India. That's awesome. India's pretty far away. I'm from the United States of America. Clinical pathology. All right, moving on. Oh, wow, so it's nighttime? Swaroop, what happened? What happened when you got the MacBook? How come it messed up? But tests are important, and you combine the tests to narrow things down. Total protein's important, albumin's important, globulins are important, and then albumin-globulin ratio is important. Globulins are all other proteins. Albumin is like 30 to 50% of the total protein. You can't game on the Mac? Really? Do they not have, or does the Mac not have Steam and stuff like that? Wow, I didn't know that. Wow. Are you able to get a refund, Swaroop? Vikrant, bro, do you live alone? No, I don't live alone. I live with my brother. Hello, Michaela. Good morning. Brief physiology. So, the hepatic production of albumin is high and constant. Albumin's always being produced, pretty much. It's metabolized in tissues over time. Oh, it does support steam, but it does not OS. But it does not. Okay. Yeah, maybe if you're able to, if you wanted to, you could return it and get a Windows PC. I think Windows computers usually support Steam and stuff like that. Guys, I'm gonna end this live stream right here, take a short break, and I'll be back in like a couple minutes. I just need to take a break from this studying, but I'll be back very soon. So thank you for watching. I'll be back in a couple minutes.